Hi, I'm Laura, and today in Portfolio 2, we'll be discussing the role of the perioperative nurse in relation to the surgical count in the intraoperative phase of surgery. Safe and quality patient outcomes in the intraoperative phase is the nurse's key goal and responsibility when surgery is undertaken. The surgical count is a process where all items that are used in surgery are counted methodically to ensure no surgical items are retained within the surgical site. The instrument nurse is responsible for the count, and it's conducted in partnership with another circulating nurse in the operating room as well. ACORN standards state that the surgical count must be conducted by two nurses at all times. Together as a team, they use policy and procedure as well as communication skills and teamwork to ensure the count is undertaken with no discrepancies or missed items. By using hospital policy and procedure, variations in the way the count is conducted is minimised. ADEL 2012 clearly states that reducing practice variation reduces the risk for count errors. A study conducted by Norton, Martin and Michelli in 2012 stated recommendations that were found to be the most important in achieving patient safety and reducing errors was the use of documentation of the counted items and any intentionally retained items, for example packing, notifying the surgical team of the count status and documenting actions taken when a count discrepancy occurs. Rowlands 2012 explored the idea of nurses being point-of-care providers. Furthermore, went on to state that perioperative nurses are well prepared to design systems and processes to accomplish the goals of patient safety, which include reducing the risk of injury and maximising the likelihood of identifying errors when they occur and intercepting potential errors when or before they occur. It's the nurse's role to be aware of errors that could occur. Smith and Burke 2014 listed the main causes of errors in the operating theatre, and causes for count errors to occur were from team fatigue, conducting complex operations, emergency surgeries, distraction during surgery, and poor communication. The surgical count nurse also needs to be aware that these situations can arise and be able to put in actions to prevent the error from occurring altogether. The count is conducted at 4 stages throughout the total operation. A thorough count is performed before the surgery by both nurses together. Every item is counted individually and set up neatly on the equipment tray to reduce errors from occurring. This is known as the baseline count. The first closing count is then performed when most of the surgery is complete and the surgeon is beginning to close up. The body cavity is thoroughly checked and all items are accounted for. If more than one body cavity is opened, a second closing count is performed where that area is thoroughly checked. The final count is vital, when the skin has been sutured shut and the count ensures that no item is retained inside the patient or lost throughout the operating room. The nurse's role in the surgical count is integral when ensuring patient safety and adverse error prevention.